The Expert Guide to Blepharoplasty Techniques. Blepharoplasty is a procedure that benefits from the expertise of a cosmetic surgeon who is well versed in all available eyelid techniques. As we age, the muscles around our eyelids gradually weaken. These anatomical changes can create several features which make the eyes and periorbital regions look aged and tired. Eyelid aging can also be associated with brow ptosis, or sagging of the eyebrow. The position of the eyebrows is therefore very important to the overall appearance of the eyes and periorbital area. Fortunately, blepharoplasty can restore the eyelids to a more lifted and youthful position while helping to correct any sight limitations. Here's a guide for you. What is blepharoplasty? Blepharoplasty is a surgical procedure that removes or reforms excess fat and aging skin from around the eyelids and to give the entire face a younger and more alert appearance. Blepharoplasty can be done on the upper eyelid, the lower eyelid, or both. It is an outpatient procedure that can often be performed with local anesthetic and IV sedation. It is well tolerated by most patients. If blepharoplasty is done to help correct a documented visual problem, a portion of the upper eyelid procedure may be covered by insurance, with the remainder of the procedure to be paid by the patient. Blepharoplasty is commonly done in conjunction with other rejuvenating cosmetic procedures, such as a facelift, a brow lift, a lip lift, or fat grafting. If this is the case, and a lot of procedures are being performed, general anesthesia may be required for the entire procedure. Blepharoplasty is one of the most common anti-aging plastic surgeries and has become more and more sought after in recent years due to its relative affordability, its functional advantages, and its beautifying results. What are common blepharoplasty techniques? This is a very delicate area of the face where the skin is thin, and this should only be worked on by an expert. The results should look natural and should be tailored to the client's ethnicity and gender identity. The quality of the results is in part related to the individualized diagnosis and surgical plan created by that surgeon for you. Let me talk about a few blepharoplasty techniques. The first is the upper eyelid pinch blepharoplasty technique. Pinch technique blepharoplasty can be a great solution for relatively young patients with a small amount of redundant or excess skin and no need for fat removal or fat repositioning. In a pinch blepharoplasty, the surgeon marks the skin to be removed, pinches that skin with an instrument, squeezing the skin into a small skin roll. The skin roll can then be excised or cut out with scissors, and the wound can be directly closed. It's a fast procedure. It also has the advantage of pre-squeezing the skin, which results in almost no intraoperative bleeding. The postoperative swelling and bruising associated with this procedure is minimal because the eyelid skin is so thin, the incision heals in an almost invisible scar. The next procedure is traditional skin excision blepharoplasty. In this procedure, the skin is marked with a surgical marking pen, and then the skin is excised with a knife or scissors. The open access created by the small wound allows removal of muscle, the orbicularis oculi muscle, removal or transposition of upper eyelid fat, and I usually say to remove as little fat as possible, and modification of the upper eyelid crease, making it higher or lower or deeper. Suture blepharoplasty technique. Sutures can be used in blepharoplasty underneath the skin to alter the position of the existing eyelid crease or to create a crease when one crease doesn't exist. The crease can be either raised or lowered, and it can be deepened. This technique can also be combined with repair of the levator aponeurosis, which is the window shade lifter of the eyelid. This will correct ptosis, or drooping of the upper eyelid. Sutures are often needed in revision eyelid surgery in order to modify the position of the upper eyelid crease. In my practice, I often use a lot of sutures in revision eyelid surgery. This creates the best rejuvenation for the eyelids. Anchor blepharoplasty technique. Anchor blepharoplasty is a popular type of blepharoplasty that is often used to fix a previous suture procedure where the upper eyelid drooping has once again become apparent or caused the eyes to look uneven. In an anchor blepharoplasty, an incision is made above the eye, the deep tissues are anchored to the tarsal plate of the upper eyelid. By anchoring the sutures to the immobile tarsal plate, as opposed to the dynamic eyelid muscle, results tend to be more symmetrical and more stable. What are the newest blepharoplasty techniques? The most current trends in blepharoplasty tend to emphasize minimally invasive techniques involving fat transfer or fat reposition, rather than simply making incisions and removing a lot of the existing tissue. I like to say, we don't look better with less fat in our eyes. We look better when the fat is repositioned. When possible, we want to reposition the patient's fat rather than remove all the fat. That ages us. By repositioning fat and volumizing the eyelids, the youthful, full appearance of the eyes is maintained. A surgeon trained in the latest techniques is in a better position to combine any number of them if necessary for the most favorable results. Is swelling normal after blepharoplasty? Swelling is definitely expected. You should expect swelling and some bruising after blepharoplasty, as this is thin skin and it's easy to make that skin and the soft tissues swell and bruise. You may feel that your eyelids are tight or stretched, but all of these symptoms should resolve fairly quickly. The majority of swelling and bruising generally subsides in 1 to 3 weeks, and using cold compresses and elevating the head can help to reduce swelling. You may need to apply drops or topical medicines to aid in the recovery process, and you should keep your face out of the direct sunlight while the thin skin around the eye heals. You should wear dark sunglasses if you need when going outside. Avoid smoking. As always, follow your doctor's orders for aftercare closely and carefully, and if you're experiencing severe pain or swelling that seems beyond the scope of what is normal, never hesitate to call your surgeon. Do I need to find a blepharoplasty surgeon near me? Certainly, some surgeons that are expert may be close to you, but patients should expect to travel to an expert blepharoplasty plastic surgeon. Do you have questions? We help people like you every day. Email us at hello@sykesplasticsurgery.com. I look forward to seeing you in my office, and thanks for watching.